Hello, my name is Trista Cassidy, and this is the Health Promotion Project Part 2 video presentation. A little introduction about my client. He is an 81-year-old white Irish-American male. He served in the Air Force for 23 years before he retired. Then he sold insurance at Mutual of Omaha before retiring for a second time in 1996. He has a medical history of hypertension, type 2 diabetes, GERD, coronary artery disease, pancreatic cancer, and a triple bypass that he had back in 2013. He has a sedentary lifestyle and is not very active. The Healthy People 2030 goal that I chose for my client was reduce the proportion of adults with obesity. The reason I chose this goal was because many adults in the United States have obesity, which is linked to chronic diseases like type 2 diabetes, cardiovascular disease, and several types of cancer, which all three my client has. So, in order to reduce the lasting effects of these diagnoses, I chose this goal. The nursing diagnosis that I have chosen for my client is at risk for impaired skin integrity related to a sedentary lifestyle, as evidenced by an increased time spent inside, a high BMI, and comorbidities such as diabetes, cardiovascular disease, and prostate cancer. I sat down with my client and we came up with both short-term outcomes and long-term outcomes. Some short-term outcomes that we decided would be achievable for him would be walking around the block 2 times a day, 5 days a week for 1 week. He also agreed that he will report no new skin breakdown by the end of the week and will take his blood pressure measurement every morning. We were going to add in other things for his blood sugar and stuff, but we thought 3 short-term outcomes would be manageable within the first week. And then as he completed these goals, we could add on new ones. Some long-term outcomes, we added a few more here. The patient will decrease his BMI below 30 within 6 months. He will lower his A1C by 1 point within 6 months. He will increase his cardiovascular exercise to 5 days a week for 1 whole year. He will adhere to all medications for 1 year, and he will check his blood sugars every day for 6 months. So in order to do this, we went over some teaching, but before we did that, we decided what type of learner he was based on the survey of preferred learning that we did in part 1 of this project. He is kind of all over the board. Auditory was the most, then kinesthetics, then a visual learner, but they were all very close. We also decided that it would be a good idea to have his eldest daughter present. She lives right next door and is very involved with his health care. So having her present during the teachings would be helpful. He said he would like some handouts so he can refer back to them, allowing him to practice during the teaching. And he doesn't have any limitations as far as socioeconomic or educational factors. He has glasses and hearing aids, so no issues as far as teaching. He's also not in the medical field, has never been around anything medical, so using layman's terms we decided would be best. So some teaching points that we went over. We started with exercise, especially with that short-term and long-term goal of exercising for at least 30 minutes a day, 5 days a week. The CDC recommends 150 minutes of moderate intensity exercise a week. That is 30 minutes a day, 5 days a week. Nutrition, a heart-healthy diet would be best due to his coronary artery disease and hypertension, and this includes a good mix of fruits, vegetables, whole grains, healthy protein, such as fish and poultry, and then minimizing the sugar, salt, alcohol, and processed foods. As far as diabetes management, diet, exercise, and pharmacology would be the best ways to do that, and testing his blood sugar every day and knowing the signs of hypo and hyperglycemia. As far as his hypertension, antihypertensive medications have been shown to reduce the morbidity and mortality in the elderly, according to an article we went over. And also evaluating him for orthostatic hypotension would be important, especially when he goes to the doctor or if he ever feels lightheaded in the morning, feels like he's going to fall. Um, Checking him for orthostatic hypotension can help reduce that risk of falling. And then lastly, skin integrity, which relates directly back to our nursing diagnosis. Some teaching points we went over were moisturizing dry skin, avoiding hot water during baths, pad and protect any vulnerable areas such as the sacrum, and then daily skin checks to look for any new wounds or cuts, especially with diabetes, looking at his feet. And yeah, so those are just some teaching points we went over. And then these are some handouts that we looked at. Um, Over on the left, blood sugar control, the signs and symptoms of hypo and hyperglycemia. So he knows he should be checking his blood sugar every morning, but throughout the day or throughout the day he should be checking it. But then also knowing the signs and symptoms is very important. Blood pressure monitoring, knowing what numbers he should be within a range of, and then some exercise and eating habit tips also on that handout. And then some skin integrity tips and how to keep your skin intact over on the right side. So, evaluation overall, the teaching was well received. We were able to do it um, in a couple different sit downs, but within one day. Um, no limitations were confronted. He verbalized understanding. His daughter was present, and with all the different techniques that we used to talk about things, it was very well received. The only thing that I would have done differently is would have had more equipment for his hands-on practice. We had his glucose monitor and his blood pressure machine, um, but that was pretty much it. Um, all the short-term goals were reached within that first week. He checked his blood pressure every morning, no new skin breakdown, and he exercised twice a day for 5 days that week. Um, as far as his long-term goals, his daughter will be there to help follow up. She is right next door and is very involved in his care, so she will be able to help him reach those long-term goals. As far as the project evaluation, I learned a lot through this project, specifically how everyone learns differently and all the different resources that we have available as nurses for our clients. And I really enjoyed this project and being able to help out someone close to me and discuss their health goals and then watching some of them come in fruition was very rewarding and we had a lot of fun. Here are my references and thank you.